What is the alpha-fetoprotein, AFP, blood test used for? Imagine a simple blood test that can give clues about your liver health and help catch liver cancer early. That's what the alpha-fetoprotein blood test is all about. This test measures the level of a protein called alpha-fetoprotein in your blood. Normally, this protein is made by a developing fetus in the womb, so pregnant women naturally have higher levels. In healthy adults, AFP levels are usually very low. But when AFP levels go up, it can sometimes signal something unusual happening in the body. In the context of liver health, the AFP test is mainly used as a tumor marker. That means it helps doctors look for signs of liver cancer, especially a type called hepatocellular carcinoma, which is the most common primary liver cancer. If someone has risk factors like chronic liver disease, cirrhosis, or hepatitis B or C, doctors might order this test as part of regular checkups. The goal is to catch any signs of cancer early, when treatment options are better. However, it's important to know that the AFP test isn't perfect on its own. Sometimes, people with liver cancer don't have elevated AFP levels. Conversely, AFP can be high in people without cancer, especially if they have liver conditions like hepatitis or cirrhosis. Pregnancy can also cause elevated AFP levels, which is normal. Because of these limitations, doctors usually don't rely solely on AFP levels to diagnose liver cancer. Instead, they combine the blood test with imaging tests like ultrasounds, CT scans, or MRIs to get a clearer picture. For those at high risk, such as people with cirrhosis or chronic hepatitis infections, regular monitoring with both AFP tests and liver ultrasounds is common. This combined approach helps identify cancer at an early stage, which can make treatment more effective. If AFP levels are very high, often above 400 nanograms per milliliter, it can strongly suggest liver cancer, especially if imaging shows suspicious areas. But lower levels might need further testing to determine what's going on. The AFP test is also useful after treatment. If AFP levels drop following therapy, it might mean the treatment is working. If levels start to rise again, it could indicate the cancer is coming back or progressing. Still, it's just one piece of the puzzle. A high AFP doesn't automatically mean cancer, and a normal AFP doesn't rule it out. That's why healthcare professionals interpret these results carefully, considering the whole clinical picture. In summary, the AFP blood test is a helpful tool in detecting and monitoring liver cancer, especially when used alongside imaging and other assessments. It's particularly valuable for screening people at high risk and for tracking how well treatments are working. But because of its limitations, it should always be used as part of a comprehensive medical evaluation. If you're concerned about your liver health or have risk factors, regular checkups and open discussions with your healthcare provider are key steps toward early detection and effective management. Always remember, personalized medical advice from a professional is essential for making the best decisions for your health.